I'm Monica Morrow, Chief of the Breast Service and Ann Burnett Winford Chair of Clinical Oncology at the Memorial Sloan Kettering Cancer Center in New York. The question of breast reconstruction in women who are active cigarette smokers is an important one because we know that cigarette smoking increases the risk of complications with breast reconstruction. And the reason it does that is because cigarette smoking causes damages to the microscopic blood vessels, both by increasing the risk of clotting in those blood vessels and by decreasing the blood supply to the skin. When we do a mastectomy, in order to get the breast tissue out from underneath the skin, we remove the major blood vessels that supply the skin, and we rely on the fat underneath the skin to keep it alive. In smokers, that blood supply is less reliable, and putting pressure on it with a breast reconstruction increases the chance that it may die. And this is true whether you're talking about doing breast reconstruction with tissue expanders or implants, which are saltwater-filled bags, essentially, that are put in underneath the muscle on the chest in this particular case, and then gradually filled up to match the size and shape of the other breast. In smokers, we know that the risk of infection, the risk of the skin and the incision not healing properly, and the likelihood of losing the implant are all higher. The other major type of breast reconstruction, which uses the body's own tissue, most commonly fat, which is taken from the belly, which is referred to as a flap or a deep flap in this particular case, actually brings a blood vessel with it, which is microscopically sewn to a blood vessel in the general region of the breast in order to keep that fat alive. And again, with smokers, there's a greater likelihood that these microvascular suturings of the blood vessels are going to clot off, requiring repeat surgery or causing death of the tissue flap. And there's also a greater risk of complications at the site where you remove the tissue to move it, namely the abdomen, in the case of the most common flap. So whether or not breast reconstruction should be done in somebody who's an active smoker is dependent on several other things. First, are there other risk factors for poor wound healing? And those would include things like prior radiation to the area of the breast or obesity. And secondly, both the patient and the plastic surgeon's tolerance for risk and complications. For many women, breast reconstruction is a critically important part of having a mastectomy. And even when they recognize there's a high risk of problems with the wound, which may need more surgery, it's still worth it for them to go through reconstruction. For other women, when they hear about these problems, that's a choice they choose not to do. Some plastic surgeons will not do immediate breast reconstruction in women who are active smokers. That depends on their tolerance of risk as well. But the one good piece of news is that studies have shown that even a short interval of stopping smoking decreases the risk of complications. So by delaying reconstruction, instead of doing it at the same time as the mastectomy, women who find out they have breast cancer and want reconstruction, or for any other reason, since stopping smoking is always a good thing, can improve their chances of having a good outcome with reconstruction. And this is also true for many women who get preoperative chemotherapy today. The period of getting chemotherapy is a time to stop smoking. Most hospitals screen patients for active smoking and have smoking cessation programs that they can refer you to if you're interested in taking advantage of a change in your health as a time to pick up more healthy habits all around. So this is something you should ask your doctor about if it's not actively offered to you.